Hello, everybody. I'm Bousrout Abdelmouttalib, a PhD student at the Faculty of Sciences in Qanitra, Morocco, and we collaborate with the Faculty of Sciences Simlalia. Before we dive in it, I'd like to express my gratitude to the organizers for giving us this opportunity to present our work in the field of medical physics, focusing on the radio aspects of biomedical implants. Our work is tied antenna design and development for leadless cardiac pacemaker. To evolve in our presentation, we will adopt the following plan. First, we'll start by introducing our topic. Second, we'll discuss the challenges in designing biomedical antennas. Next, we'll explore the different frequency bands involved. Then we'll present our work focusing on antenna design. After that, we'll discuss the results and compare them with similar research. Finally, we will summarize our key points in the conclusion. Introduction. Implantable medical devices are important tools for disease diagnosis and human health monitoring. They serve various functions from surgical implantation to external use, for example, ultrasound technology. But today we focus on the former type. So the implantable medical devices play an important role to diagnose the disease as we use it for monitoring of human health. Biomedical devices placed in human body. The implantable medical devices collects the data from the human body. Antenna system send the data to external unit, and biomedical antennas operate within the human body, which serves a dissipative transmission channel, unlike antennas operating in free space. Now let's move on to the very interesting aspects, frequency bands. Choosing the right frequency is crucial because it depends on of the implant. Uh, Firstly, the distribution of frequency bands is regulated. Here are some examples of these bands. Firstly, the well-known ISM band, 2.4 gigahertz, is intended for implants requiring a high data rate. However, it carries a maximal risk of interference due to its common use. The second example is the mid-radio band. This band is suitable for applications requiring a low data rate or not needing continuous transmission reception. For instance, in this case of implants designed for therapy monitoring, which require least real-time communications, this band is characterized by this band is characterized by a very interesting range, unlike the ISM band, which is normal because the wavelength is proportional to the frequency. The last example is the ISM band, which exhibits low interference and is ideal for implantable medical devices. Now let's delve into the technical details. As you can see, our proposed patch antenna is a simple spiral design. Several research studies have shown that this chip is less prone to losses. The antenna is ultra miniaturized. To achieve miniaturization, we've created multiple slots into the patch and the ground. This approach elongates the path of surface current, thereby reducing the antenna size. Among various available miniaturization technique, agent slots is the simplest. The ground, we have used Rogers 10 as the substrate and superstrate. And these materials were chosen for their beneficial dielectric properties including flexibility, adaptability, and biocompatibility, making them suitable for medical applications. The antenna is excited using coaxial cable, contributing to miniaturization as coaxial cables occupy less space than microstrips. Design process of the proposed antenna. The development of the proposed antenna followed a four-step optimization process. Initially, a relatively simple configuration was established, incorporating spiral-shaped slots in the patch and the two slots in the ground. This spiral shape is commonly used in biomedical antennas because research has shown it to be less sensitive to the body's dielectric effects. And each step, additional slots were created or modified to achieve better performance based on S11 coefficient. Let's turn to parametric study. Impact of feed position. The variation in the antenna's feeding point position significantly affects S11 and impedance matching. The following figure illustrates these effects and their reflection coefficients across different frequencies. This variation highlights the major impact of the feeding point's location. After exploring various positions, it's evident that position 4 is optimal. In conclusion, the feeding point's location is crucial to ensuring stable impedance matching, enhancing overall antenna performance, controlling resonance frequencies, and optimization the enhancing the performance of antennas. Now move into the study of resistance to achieve a better impedance matching and bandwidth. We explored the various resistor positions until we found the optimal one as depicted in the figure 5 and 6. Following this, we tested several resistance values, analyzing the S11 parameter each time. After multiple simulations, we determined that 5 ohms is the best value and position 4 is the best position. Move to simulation and environment. The antenna is intended to operate inside the human body. The initial phase of this development involved modeling and optimization in uniform phantom model design under HFSS or CST. This step was created using HFSS, electromagnetic properties of cardiac tissues, uh, for example, conductivity and dielectric permittivity, were considered to ensure accuracy of results at the frequencies. To confirm these findings, a second simulation was conducted using CST at, on the same phantom model. Now turning to the antenna's radiation performance, simulations were conducted in the presence of the phantom figures. Compare the figure 9 compares the far-field polar gains. This pattern exhibited this patterns exhibited nearly identical behavior, though the simulation begins at 1.2 GHz is minus 34 dBi, and though the simulation peak gains at 1.2 GHz obtained for HFSS and CST with and without system is around minus 34 dBi, and at 2.4 gigahertz is around minus 90 dBi. And you can say that the antenna performance not affected by the uh, system or by the effects coupling. Another important parameter to consider is the specific absorption rate. Assessing SAR is crucial to ensure compliance with I3A biocompatible devices safety standards. The standards establish strict SAR for different doses masses to protect patient health, and the results indicate that SAR values are within the I3A guidelines, making the antenna suitable for implantable medical devices. Here, this table presents a comparative study of our antenna with other works in the field of biomedical antennas for our application. In terms of miniaturization, as you can see, uh, our antenna is ultra miniaturized, dual band, and offers a wide bandwidth with high gains for biomedical antenna. It also meets health standards for patients, and the antenna has been simulated in the presence of the implant or device. In conclusion, introduction of the wideband implantable antenna for biocompatible applications, specifically for leadless cardiac pacemakers, miniaturization technique employed, including a resistive element and rectangular slots and the ground plane. Final compact design. So our antenna is ultra miniaturized, and for safety, SAR study confirming the safety of the implantation in patients. And thank you very much for your attention.